This is Mental Health Assessment Phase 3 assignment based upon client John Sample's test results that show elevated levels of depression, hopelessness, distress, and anxiety. Hi John Sample, I reviewed your results for the BDI, BHS, BAI, and the BSS tests you took. Based on the results of the BDI, which is called the Beck's Depression Inventory, you scored a 32, which is considered to be severe concern that needs to be addressed, as moderate would have been a score of 30. So your score is much higher than average, and this shows that depression is an issue for you and something that we can discuss further as it relates to your relationships and work. As for the BHS, called Beck's Hopelessness Scale, you scored 13, which is considered to be moderate, whereas 15 would be considered severe. Being in the moderate category is better than severe, obviously, but you are close to severe and is a cause for concern, as long-term studies have shown that moderate to severe BHS scores can lead to significant risk of suicide if not resolved. So this is something that we can focus on lowering your score through therapy plan, and we can further talk about your feelings through these results. And for BAI, called Beck's Anxiety Inventory, you scored 18, and this is considered moderate, where 30 is considered severe. So being moderate in this category, again, is better than severe, and you scored more in the middle of moderate, but I do have concerns as you may be at a higher risk of suicidal behavior, as your impulse control score was higher in this test than normal. The final results for the BSS, called Beck's Scale for Suicide Ideation, in which you did not finish, therefore an incomplete result scored very low at a 2. A score of 2 on a completed test would mean little or no concern of suicide, harming others, or harming yourself. But on a previous BDI, the BDI test that you previously took, you had answered questions of concern of suicide. So I'd like to clarify these questions where, at one point you're talking about concerns of suicide, other times you're not. And these contradictions between killing oneself are something of very great concern and something we need to talk about. The question on the previous test you answered, you had said that you would kill yourself having the opportunity. And on this test you took here, you answered you have no desire to kill yourself and would save your life in a life-threatening situation. So based on these conflicting answers, I would like you to complete the BSS, that's the Beck's Scale for Suicide Ideation, to get an accurate suicide assessment. And remember, honesty is going to be very important in counseling, and your accurate answers are going to be the best way for us to resolve these issues you face.